Hello, everyone, and thank you for joining today's webinar. My name is Kimberly Brunel, and I'm the Ontario Regional Support Liaison for AAMAC. I'm so pleased to be joined today by Cindy Murray, a nurse practitioner from Princess Margaret Hospital. Cindy has been working on the front lines of COVID-19, and she's here with us today to share her experiences and to answer any questions that you might have. At this time, all of the lines are muted, but if you have any questions throughout the presentation, there are two different ways that you can share your question with Cindy. If you want to verbally ask your question, you may notice a little hand icon next to your name. If you just click on the hand icon, it'll tell me that you have a question. Then I'll stop the presentation and unmute your line, and you can ask your question to Cindy. If you don't want to do it that way, you can also just type your question in at any point during the presentation in the question box, and we'll answer that question either throughout the presentation or definitely by the end. Just as a reminder, the webinar will be recorded and will be made available on our website following the presentation. So if you missed something or if you wanted to write something down, you can always go back and view the presentation later. So I will now pass it over to Cindy Murray. Thanks, Cindy.
Okay, thank you, Kimberly. Hi, everyone. I'd like to thank Kimberly from AAMAC for asking me to talk with you today about COVID-19. I guess you know, usually using virtual webinars is now the new normal for meetings since this pandemic has kind of taken over our lives. So I haven't done a lot of presentations this way yet, so forgive me if there's any technical faux pas in the next hour. Hopefully not, and hopefully if that does happen, Kimberly will be able to fix it for us. So the one thing that always sort of bothers me a bit about these webinars is not being able to see the presenter and wondering always what they look like. So I thought I would just put this picture of me at work in our new work attire. Up until this pandemic, we always wore street clothes, and you probably couldn't tell the difference between us and a lot of the patients, except for our name tags. But this is the way that we now have to work, and it's probably going to stay this way for quite a long time. So I thought what I would start with is a brief overview of what COVID-19 is. I think most people are aware with this infection now, but it just kind of seemed like the logical place to start. So COVID-19 is the name of the infection that develops when you get infected with this new coronavirus that was detected in 2019, as you know, in China. Hence the name COVID-19. And coronaviruses, there's many different types of coronavirus, and they're the viruses that are responsible for causing the common cold, bronchitis, pneumonia. It's a type of virus that was responsible for SARS back in 2003. You probably remember that. And I kind of liken it to HIV and AIDS. So HIV, the human immunodeficiency virus, is responsible for causing the condition known as AIDS, which is the immunodeficiency syndrome. So COVID-19 is kind of the same thing. The coronavirus is responsible for causing the infection, which is known as COVID-19. So how is this infection spread? And I've put on the slide, this is what we know now, because this has been a moving target, particularly for us who were working with patients at the front line. We were given a lot of conflicting information about how this virus was transmitted or how this infection was transmitted from person to person. And that was because honestly, no one really knew, and the information was evolving, and so it kept changing. I think now it's pretty settled, and we know that it's transmitted from infected people to others who are in close contact through respiratory droplets. So anyone who has an infection, who is doing a lot of sneezing, coughing, or spitting up, those fluids are containing the virus that can cause the infection. So you can get it from direct contact with infected people, or you can get it from contaminated objects and surfaces. So when someone coughs or sneezes, some of these droplets that are released from their nose or their mouth can land on objects and live there for a period of time. And depending on the type of surface, can live anywhere from a few hours up to a few days. So hence the importance of wiping down all the surfaces if you're concerned that they might be contaminated by someone who might have the infection. And this is also the reason that you're told to stay away from people at least by 6 feet. And I think that most places that you go to now, hospitals, grocery stores, drugstores, have put tape near their checkout counters to keep people or to remind people how far 6 feet away is. The other really important thing that we've been told, and that's a really hard thing to do when you consciously try to avoid it, is touching your face. So big recommendations, don't touch your face, because if you have the virus on your hands, that's how it gets into your system, through your nose or your mouth. So what are the symptoms of COVID-19? Well, it affects different people in different ways, and most people will have mild to moderate infections and then recover. So most of the literature you read is that most patients, about 80% of patients, are going to have a mild to moderate case that's pretty self-limiting and will go away on its own. Of course, those aren't the cases that are highlighted in the media because they're not that exciting or dramatic. So you always hear worst case scenario in the media. The most common symptoms are fever, dry cough, and extreme tiredness. So sort of like the flu, if you've ever had that in the past. The less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, which is a itchy redness to the eyes, headache, loss of taste and smell, and sometimes rash. Now, people present in different ways, and I have 3 very close colleagues that I work with who presented in totally different ways. One colleague presented with a headache. She just had a mild headache, didn't know where it was coming from. And 3 days after the headache started, she kind of lost her taste of sense and smell, which prompted her to go to get tested, and she had COVID-19. Another one of my colleagues presented with a cough, and the cough just wouldn't go away. And she started getting fevers after the cough and went and got tested and was positive for COVID-19. So they can kind of present in different ways. If the patients, or if anybody has difficulty breathing or severe shortness of breath or chest pain or loss of speech or movement, which could indicate maybe the virus has gotten into the central nervous system somehow, those are serious symptoms and they should present to the closest emergency department. I had one colleague that did present with very severe shortness of breath. She also had underlying asthma. She ended up having to call 911 and presented to the emergency department there. So not to scare you, but just to make you aware that there's a lot of different ways that people will present with this. Sometimes it will depend on if they have any underlying issues. So my one friend that presented with the shortness of breath and had to call 911 and go to the emergency department, she has underlying asthma. So she already had a compromised respiratory symptom, and then when she got infected with the virus, it just made it worse. But I think what's really important to remember is that most people will have a mild to moderate illness and recover from that. So when do these symptoms show up? Well, this is kind of the unsettling thing about COVID-19. People can be infected with COVID and not show any symptoms whatsoever or have very mild symptoms. So we call these people asymptomatic carriers. So they can be infected and the symptoms maybe not show up for 14 days. The average length of time from the time someone's infected with the virus until the symptoms start to show is about 5 to 6 days. But it can be anywhere from 2 to 14 days. So this is very different from the SARS virus back in 2003. Most infected people became symptomatic right away. So this has been kind of the really unsettling thing with COVID-19, and it's something that we've kind of learned as information has evolved, is that there's a lot of people who are asymptomatic who could be transmitting this virus from person to person. So now at our institution, any patients who are coming in for treatment but don't have any symptoms, we will be swabbing them occasionally just to make sure that they're not one of those asymptomatic carriers. They've also started swabbing the staff at our hospital who are working with cancer patients just to try and identify any staff who may be asymptomatic carriers. So who is most at risk with this virus? I think everyone's familiar with the older adult population being most at risk, and we've seen this very sadly in our long-term care facilities. Also, people who have chronic underlying diseases. So for instance, chronic obstructive pulmonary disease or COPD. People who have diabetes, maybe who have kidney failure, hypertension. It makes a big difference if someone has underlying disease or not, how they're going to respond to this infection. And also people who are having cancer treatments or have recently completed cancer treatments, because their immune systems are probably still compromised from those treatments. So it puts them at increased risk of picking this infection up. So how can you protect yourself and others? Well, I think the number one thing is washing your hands regularly with soap and water or an alcohol-based hand rub. Soap and water, I listened to a presentation a few weeks ago from a scientist at Sick Kids, and he was explaining how the virus doesn't tolerate soap at all. So I think soap and water is ideal if you can, but otherwise those alcohol-based hand rubs. I think it's a little unnerving to watch people walking around with gloves thinking that they're really protecting themselves even though they have gloves on, because then they sort of forget that they have gloves on. They think they're protecting their hands. They touch their face with their gloves, or they dispose of the gloves but don't wash their hands after. I think probably the more important thing to do is to protect yourself by washing your hands with soap and water, and if not, have one of those alcohol-based hand rubs. Like I have one in the car. After I come back in from the grocery store, I just give myself a squirt and wash my hands, and you really need to wash your hands for about 20 seconds. 20 seconds doesn't sound like a very long period of time, but if you've ever tried to hold a plank or something in an exercise class, 20 seconds can be a very long time. So it's just really important to kind of count out the 20 seconds while you're washing your hand. Maintaining at least 1 meter of distance between you and other people, and I think everyone's quite familiar with that, and the physical distancing or social distancing. Avoid touching your face. We're told to do that all the time. Cover your mouth and nose when coughing or sneezing, so that if you are one of those asymptomatic carriers, you're not spreading it. So either cough into your elbow or make sure you cover with your hands, and then wash your hands thoroughly after. If you think you may be infected with COVID, it's really important to stay home and self-isolate if you're feeling unwell, because you could possibly have it and you don't want to spread it to anyone else. Refrain from smoking and other activities that weaken the lung, because this is a respiratory virus. It gets into your lungs, and that's where all the problems start. So if you're a smoker, you're putting yourself at higher risk right away, because the lungs are going to be compromised a bit. and to avoid any unnecessary travel or staying away from large groups of people. So I think probably the most recent protective advice was, if you're going somewhere that could possibly be crowded and it's impossible to physically distance yourself, and I think of where I work, in the clinic that I work in, it's almost impossible to stay 6 feet away from each other. We are giving all the patients that walk in the door masks, and all the staff are wearing masks. It gives you some protection if you can't keep away from people by a distance of 6 feet. I even notice now that there's some grocery stores that won't let you into the store unless you have a mask on. So what can you do if you think that you have symptoms that are suggesting that you could be infected and have COVID-19? Well, as I said in the previous slide, just make sure you isolate yourself from others, mostly to protect them. Do an online assessment. So the government of Ontario has a self-assessment screening questionnaire that you can go through, and there are all kinds of these online. So I think you know, if you're associated with some hospital or cancer center, you can probably go to their websites, and they'll also have one of these online self-assessments to go through. I think Toronto Public Health, and I think probably all other public health agencies in Ontario as well. When you go on and do that assessment, they ask you a series of questions, and it will then give you advice. If you have symptoms that they think you could possibly have COVID-19, the advice will be to either call telehealth, and they give you the number, or to talk to your primary care provider, who will then advise you about going to a COVID assessment center. You can't just go and show up at a COVID assessment center and get swabbed because you want to know and you don't have any symptoms. You have to be referred, and that's just because they would be overwhelmed and wouldn't have the capacity to do all the swabs. So I think everyone is feeling stress and anxiety about this infection. And I think that one of the reasons we're feeling most stress about it is because we don't know a lot about it. The information is evolving. We've kind of gotten mixed messages from the start of this. You know, one day you're told to do this, the next day you're told to do that. Some things that were supposed to be open would be closed. So there was a lot of mixed messaging. I noticed that that's kind of settling down now, and the messages are pretty consistent. So that's reassuring. But some of the symptoms that you might be experiencing that you may not even associate with stress and anxiety are listed on the slide here. So just fear and worrying, maybe changes in your sleeping or eating patterns, difficulty concentrating. If you have chronic health problems, maybe they seem a bit worse. An increased use of alcohol. It kind of blows my mind away when I go up to my local LCBO just to drive by. There's a lineup every single day. I've never seen it during the hours that they're open to not have a long lineup. So I think a lot of people are passing the time away with drinking alcohol, which probably is not a very smart thing to do. But those are some of the symptoms of stress and anxiety. And I know even at work, talking to my colleagues, and where I work in a cancer center, I think we've done a really good job of keeping the infection out of the center, but I know my colleagues get stressed about it. And we were just talking the other day, and we said, we don't even realize that we're stressed, but I think we really are. So what can you do to support yourself? One of the things for sure is just to take a break from the pandemic news. You know, it's everywhere you look. It's in the newspaper. It's on the front page of the newspaper. Any social media that you may be on, whether it's Instagram or Facebook, everything's about COVID-19, and it gets a little overwhelming. So don't forget to take breaks from the news and focus on something else. Take care of your body if you can, regularly exercise. This is really hard when we've been told not to go out, not to do things. Gyms are all closed. Get plenty of sleep, avoid drugs and alcohol. Just relax and do some of the things that you enjoy doing. I don't know. I started knitting again. I used to knit years ago and I kind of ran out of time and gave it up. I started doing that again just because I find it relaxing. I've found some good yoga classes online that are free, and surprisingly, they really do help, and it is pretty easy to do it in your own home. And try to connect with others. Being socially isolated can be very stressful in itself. We're lucky now that we have FaceTime and WhatsApp and Zoom so that we can try and reconnect with others so that we don't feel terribly isolated. So that's just about COVID-19 in general. And I thought I would talk a little bit more about MDS and COVID-19. And the reason I chose MDS is that I know a lot of the people that come to some of the AAMAC meetings have MDS. I know there's some other bone marrow failure disorders as well, but I think a lot of the information is applicable. So one of the questions that is asked a lot is, are people with MDS more likely to get COVID-19 or develop a worse infection? Well, right now, as of yet, there's not a lot of published data to support this. I think it's very difficult to answer this question broadly as well, because MDS is such a heterogeneous disease. It's not really just one disease, it's a whole bunch of different diseases. You've got low risk MDS, you've got high risk MDS, you've got people on many different types of treatments. So to give a blanket statement about MDS and patients with COVID-19 is really difficult to do. You know, if you have neutropenia, so those subtype of white blood cells that are the neutrophils, that are really responsible for fighting bacterial and fungal infections. If you're getting treatment or if your disease has knocked down that neutrophil count, you're at risk for higher risk for infection anyways, but it's more the bacterial and fungal types of infections as opposed to viruses, which is what COVID-19 is. If your lymphocyte count, which is another subtype of white blood cell, is really low, or if you have had a bone marrow transplant recently, your immune system is really compromised, and there is a greater risk for getting infected with COVID-19 if you're exposed to it. So I guess it's just being aware of what your white blood cell count is, and if you're on any immunosuppressant type of treatment like steroids, or if the MDS itself has just caused your white blood cell count to be low because of the disease. For sure, you're at higher risk of any infection, and that includes COVID-19. So another question, and I took these questions from the American Society of Hematology, which, as you probably know, is a society of hematologists out of the United States. And they have a web page, and I found these questions there that they were getting asked by patients. Should MDS treatment be delayed? And I guess, again, the short answer is it really depends on whether, you know, your disease is considered high risk or low risk. If you have high risk type MDS and say you're being treated with hypomethylating agents, which include like azacitidine or decitabine, those drugs should continue because the intent of treating you with those drugs is to actually change the course of the MDS. If you have low risk MDS and you're being treated with transfusions only because it's only your red blood cells or your platelets that are being affected, you know, maybe the treatment could be delayed. And when I say treatment, I mean transfusions. Like maybe you're used to having a hemoglobin of 90 or even 80, and the trigger for transfusing was less than 80. You know, if you could stretch it down to 70 or 75 without having a lot of symptoms, that would probably be the smart thing to do, because the main objective is to stay away and not potentially expose yourself to infection. And coming into a hospital or a treatment center where there's a lot of other people should be avoided if at all possible. If someone has had or is planned to have an allogeneic stem cell transplant, this might be delayed because we've been running into some issues with donor availability, particularly if the donors are not in Canada, they're outside the country, just sort of accessing the donor cells that are necessary for the transplant. And again, not wanting to bring you into hospital and put you at a higher risk of being exposed. So if the treatment can at all be delayed, your oncologist is probably going to highly recommend that until this pandemic slows down or we have a better handle on it. So I know a lot of people with MDS are dependent on transfusions, and one question that I've been asked is, are blood products safe? So I did talk to Dr. Christine Charity, who's one of the transfusion medicine specialists at University Health Network, and I also went on the Canadian Blood Services website. As of right now, there's been no transfusion transmitted cases of respiratory virus like coronavirus or influenza ever reported in the literature. So I think it's pretty safe to assume that it doesn't get transmitted this way. Do we test products for the coronavirus? I asked Christine Charity that, and right now at Canadian Blood Services, we are not. Blood products do get tested for other transmissible diseases like hepatitis and HIV, but right now they're not being tested for coronavirus. However, the donors are being very carefully screened prior to donating any blood right now. So if any donor has traveled outside of the country in the last 2 weeks, if they have any symptoms suggestive of a respiratory illness, if they've ever had the coronavirus in the past, if they've been in contact with somebody who's had coronavirus, then they will not be allowed to donate any blood products. So this has kind of led to a little bit of a shortage of blood products. We haven't run into any major ones yet, but we're just being asked to be a little more careful in transfusing people if they can possibly get away with not needing a transfusion. We're trying to be a little more selective these days. You may have heard talk about convalescent plasma, which is taking plasma from a person who was infected with the coronavirus in the hopes that they have antibodies in their blood that they would be able to pass on to people who have COVID to try and treat it. So there's a clinical trial going on across Canada right now, collecting plasma from people who have had COVID and hopefully are carrying the antibodies to see if that could be used as a treatment for patients who are really sick in the hospital and have it. So we've been asked, is there any tips for hospital visits? I would say one thing that's really changed a lot at our institution and our cancer center, and I think this is true of all the regional cancer centers in Ontario, is that a lot of in-person visits with the doctor are being changed to remote appointments, either over the telephone or telehealth. I've noticed a huge difference in the number of people that are coming into our clinics because a lot of physicians are doing clinic visits over the telephone or, like I said, over telehealth. So I think what's really, really important is if you have an upcoming appointment at the cancer center, or even to get a blood transfusion, say, call and confirm the appointment prior to the visit. I've seen a lot of people that have shown up because they had a visit booked, say, 3 months ago, and then they get there only to find out that their visit has been canceled or changed to a telephone visit. And this is really upsetting if you've come a long way. But I guess my advice would be phone and find out and make sure it hasn't been changed. I know that all the administrative assistants that work with the physicians have tried to get a hold of people to change appointments, but sometimes it's not always possible, and sometimes it gets overlooked, particularly appointments that have been scheduled quite far in advance. So my advice would be just confirm and make sure. Or a lot of institutions and cancer centers now have patient portals where you can look and see what your most recent appointment is. Have a look at that. Also, most centers now are restricting visitors. So before you bring any family member or caregiver with you, check and make sure they're probably not going to be allowed into the cancer center. We're very strict at our place now. It would be under very, very strict, reasons as we let someone else in. So this becomes important because I know for, say, a transfusion, if someone is driving you down to the hospital and dropping you off, there's often nowhere for that person to go because everything is closed. They can't go to the local coffee shop, they can't go shopping. So just make sure that you're prepared ahead of time for that. If you have to bring a lunch, I know sometimes there's long waiting periods, and if someone's going to get a transfusion, that could be to 3 to 4 hours. So just make sure you're aware of that ahead of time and check accordingly. Most cancer centers or institutions have their web page now dedicated to information around coronavirus, so have a look at that. They're wonderful resources. Also be aware that COVID screening is being done at every entrance into every institution now. There's screeners that will ask you, have you had a fever? Do you have a new cough? And have you traveled outside the country? Have you been in contact with anyone? And if you have, then I know at our institution, you would be sent up to the COVID assessment clinic, which is a separated area from other patients. And then up there, you would be assessed by a physician or a nurse practitioner. And I've worked up there a little bit as well. And there'd be a thorough going over of your symptoms and your history. And if there was anything that suggests you may be infected with COVID-19, we would order a swab and send you home and postpone the treatment if we could until the following day when we would have the results of the testing available. So again, here's just what our website at University Health Network looks like. It's updated on a very regular basis. It'll even tell you how many patients within Princess Margaret, Toronto General, Toronto Western have been diagnosed with COVID-19, how many staff. The numbers may look big to you there, but in actual fact, we've been very lucky and we haven't had a whole lot of cases, not at all what we were expecting. Unfortunately, those cases have all shown up in the long-term care facilities. So there's lots and lots and lots of information online if you are wanting more information. So just some of the helpful resources that I found, the World Health Organization website is really good. It has a lot of information directed for healthcare providers and for lay people. The Toronto Public Health Helpline is available, I think, 24 hours. It's manned, I think, during regular working hours, but then after you can call 311. Like I said, your hospital or cancer center webpage, the Public Health Agency of Canada, Public Health Ontario. And if you're looking for MDS-specific resources, the MDS Foundation, the International MDS Foundation, has an excellent website that you can go to that will answer some questions. And also, as I mentioned before, the American Society of Hematology has some very helpful resources as well. So that's about all that I had really prepared. I was hoping that people would ask some questions because it's really hard to kind of anticipate what people want to know. And we don't want to overwhelm you with information that you might not be looking for. So with that, I think I'll open it up to any questions that people may have.
Thank you, Cindy. I've sent you one question. Do you see it there?
No, do I go into chat?
Yeah, just look in the chat box there. You'll see it.
Okay. Oh, yeah, I see it. Okay. Well,
I'm happy to read it to you if that's helpful.
oh, I think I have it. It is, if you're dissatisfied with a remote physician visit, will physicians see people in person? That's it?
Yes.
Okay. I would say it depends. So it depends on what you're dissatisfied with. Physicians are really trying not to bring people into the hospital unnecessarily. Again, trying to protect you and trying to protect the other patients in the hospital. So I would, I think you need to have something specific that you want to see them in person about. If it's just, I don't like remote visits because I don't think I get as thorough assessment, I think the answer is going to be no, because we just don't want to put you at risk of picking up an infection. So if you wanted to talk to your physician, just be really specific about why you would want to see them in person. Another question came up. What would be the most important thing for patients to let healthcare professionals know if they're not familiar with MDS? So I guess what you're asking is, if you show up, say at the emergency department or somewhere, and the staff there is not familiar with MDS, what should you tell them? I think the most important thing to tell them is that you have a condition that compromises your immune system. So you're at higher risk for picking up infections than the average person who doesn't have MDS. So just let them know that, and that should satisfy them.
Thanks, Cindy. Are there any other questions? You can put your hand up if you wanted to ask verbally, or again, you can type. I'm just watching the questions in case I've missed any here. I'll just start to close up then, Cindy, and I'll just watch in case anything else comes in.
Okay.
Did you have anything else that you wanted to add before we wrap up?
I pulled a list of questions. I'm not sure if you sent it to me, Kimberly, or if I found it on the ASH website.
Sure.
And I can just throw a couple out there just because we have
that would be great.
Is there a difference between the susceptibility for the coronavirus between patients with bone marrow failure and those who do not have bone marrow failure? And the answer to that is that yes, anyone with bone marrow failure is more susceptible to infections in general. So you would be more susceptible to the coronavirus for sure, because it's an infection, than the person who doesn't. I guess too, what someone might want to know is, if I got the infection, am I going to have more severe consequences because I'm immunosuppressed? I thought that. I just thought, well, yeah, probably, because you wouldn't have the immune system to fight it off. But we did have one patient who actually did have MDS, who got coronavirus. He had been down in Florida. And you know what? This guy was asymptomatic. He had a bit of a runny nose that had been an ongoing problem for him. And he tested positive, and we were all frightened that he was going to get really sick. And he didn't. He did really well. We also have at our hospital, we had a whole ward that we had emptied out that we were calling the COVID ward. So any cancer patient that that got infected with COVID-19, the plan was that they would be admitted there so that we could kind of isolate them, but look after them also from a cancer perspective. And we've only had 2 people in it in 8 weeks, and they did really well and just went home. So, you know, again, I think we get frightened by all the dramatic worst case scenario stories that we hear in the media. Yes, you certainly need to be aware and cautious. My experience with the patients I look after is that they're used to doing this anyways. They've got compromised immune systems, and they've had that all along, and they're very good at staying away from infections and people and keeping their distance. And so this hasn't been a big shift from their normal behavior, and I think that's done them well. We certainly haven't seen it in the patient population that we're dealing with that we expected.
Oh, that's really helpful. Thanks, Cindy.
Oh, you're welcome.
It's good to hear that that patient pulled through so well. I would have thought the same thing that you thought, that maybe it wouldn't have gone, they would have become very sick.
Yeah, and there just doesn't seem to be any rhyme or reason to why some people do really poorly and some people do okay. I mean, for sure, people who have underlying chronic illnesses, like I said before, like COPD or diabetes or kidney failure, yes, for sure. But then, you know, you always hear about those young people who are in the ICU, and they haven't been able to determine why sometimes some people just don't do well.
Exactly. That's what makes it also frustrating.
For sure.
I don't see any more questions coming in, but if anyone does have any questions following the presentation, you can always reach out to us, and we're happy to connect you with Cindy for any follow-up. Thanks so much, Cindy, for joining us on your Saturday. I really appreciate it. This was really informative.
No, it felt like there was a lot to do anyway.
Yeah, exactly. It was great to hear your perspective and what you're experiencing in the hospitals, and I think some really great tips for those who are having to enter the hospital or potentially still in treatment, some options for them. So I think that was very helpful. Thank you.
Okay, thank you.
Just to let everybody know that this will be recorded and will be available on the website next week. We are going to be having another webinar. Next webinar is scheduled for Friday, May 22nd. We'll be joined by Dr. Heather Leach, who will provide an update on COVID-19 followed by Q&A. If you want to register for that, you can find information on our website. Thank you again so much, Cindy Murray, and I hope everyone has a great weekend. Stay safe, and thank you for attending. Bye, everyone.
Bye.